just as to be transparent, I've been interviewing Dr. Tom for 25 years. Really got to know him very well, so much so that he's now my personal physician, and Dr. Tom has seen parts of me that you definitely don't want to. So let's just be clear about that. Right, Tom? Right. All right, let's
right.
Yeah, right. Thank you. All right, if you get the virus, let's go back to our text questions. Is the virus an automatic death sentence, or can you make it through?
Well, first of all, Walt, I would tell you that the good news here is that the majority of folks that do get the illness, it's usually mild symptoms. And then a lot of people, even if they get more major symptoms, with the right treatment, early intervention, we're seeing that most people survive. But the concern is there still are a large number of people who are going to die from this. That's why it's very important for us to continue doing the things that we're doing and making sure that the hospital have all the equipment that they need to take care of these folks.
There's a lot out there, Tom, discussion about vaccines, about infection, about reinfection. We're trying to sort through, and that's why we call this facts, not fear. What about reinfection? Any research being done on any of that?
Well, there's a lot that we don't know. Right now, we're so focused on, as we should be, with the infection. The reinfection is a secondary issue that is true. And it has to be a concern because that happens with a lot of different viruses and conditions and bacteria. We don't know that yet. So right now, I think the focus has to be on primary prevention. One, not getting it, of course, not spreading it, and then working on these things that are going to help us mitigate this and treat it. So the treatment options, a lot of stuff's going on that we don't know about, that's in the works, that may show promise in some clinical trials. And the vaccine is not going to be here tomorrow. It takes some time and attention and good studies to do it. I know the FDA and everybody's going to fast track that, but it's going to take some time. Right now, it's just trying to get over this first infection and trying to prevent that spread.
Okay, the next text question kind of goes to what you were just talking about. When is this awful virus going to end? Will it go away? Is it never ending? I'm assuming if we look at what started in Wuhan, China, and if we're led to believe the time frame from beginning to subsiding, that we have a general idea. Are you going by that?
Well, you know what? I'm going by what the experts are doing. I mean, there's smart people working on this. They're using the experience and heeding warnings from what has happened in other countries where they've seen that there was a big spike. A lot of people died, but they were able to see that really to try to flatten the curve with those things that they did to mitigate the spread. So there's a lot we don't know. We do know that it's not going to good news. It's not going to last forever. There's going to be some weeks still ahead of us of doing this. We haven't seen that peak yet, but we're still got to just pay attention, hunker down like we're doing now, because we've got some time to go to make sure we, stop the spread, slow the spread, and decrease the number of people who die.
All right, next question from a viewer. I was recently tested for coronavirus. The doctor did the nasal testing, but the person noticed from watching the news of people being tested via a throat swab. What are you hearing is more effective?
Well, right now, the standard is for us to do a nasal swab. So that's the standard. That's what we're talking about in the testing. As we know, there's now things are coming out with a rapid test, and those things will evolve. But right now, it's still getting the specimen, adequate amount of specimen that you can take to the lab, analyze it, and get those results back.